has questions and concerns. Tonight, let's answer some of them. Joining us to help with that is Dr. Lipi Roy, an internal medicine physician and an NBC News medical contributor. Dr. Roy, good evening. Good to see you.
Happy Sunday, Joshua. How are you doing?
I am great, especially since we're going to answer some questions. I love answering audience questions. We got some. Let's see how many we can get through. Let's start with the first one from a viewer who asked, please talk about the risk from a COVID-19 shot. I'm hearing rumors. I want facts. I have been told that Bell's palsy is a side effect of the vaccine. Bell's palsy is a sudden weakness in the facial muscles, kind of makes one half of your face look like it's drooping. Dr. Roy, have you heard about that, Bell's palsy with the vaccines?
Yeah, so first of all, I've heard of Bell's palsy because I've treated patients with Bell's palsy, and you're absolutely right, Joshua. It's a paralysis or weakness, sometimes some muscle twitching, typically on one side of the face, causing facial drooping on one side. It can happen on both sides, but that's very rare. So far what we've seen is of the 37,000 people who've been vaccinated, 7 cases of Bell's palsy have been seen, both with the Pfizer-BioNTech vaccine and Moderna. However, so if you do the math there, that's 99.98% people who did not get Bell's palsy. Only 0.02% did. So these numbers, or this incidence of Bell's palsy amongst those who got vaccinated, is fairly consistent with the general population of Bell's palsy. So we're not, the manufacturers do not think there's any correlation or causation. That said, both Pfizer, BioNTech, and Moderna are closely investigating these cases, Joshua.
Let's keep going with a question from Miles. Here's what Miles wants to know.
Roy, my name's Miles. I'm a 61-year-old black male in excellent physical health. I had a severe allergic reaction to a flu vaccine about 20 years ago. My fiance is a 57-year-old black female with asthma. I'd like to know if it is advisable for either of us to take the COVID vaccine. Thank you.
Good question, Miles. Dr. Roy, before you answer, I should note that nothing that you hear from us tonight is a substitute for the advice of your own doctor about your own situation. But generally speaking, Dr. Roy, what would you say to Miles?
Yeah, Miles, what a wonderful question. Thanks for asking it. So according to the CDC, if you had a severe allergic reaction to any other vaccine, not COVID vaccine, other vaccine or other injectable, the recommendation is to talk to your doctor before you get the COVID-19 vaccine. As for your fiance, she falls under the category of yes, get the vaccine. She's black and she has asthma, which is considered a risk factor for getting a severe disease. So she recommended to get the vaccine. You, Miles, talk to your doctor first.
And best of luck to you both, you and your fiance, Miles. Let's get to a question from Robin. Here's what Robin wants to know.
Hi, my name is Robin, and I work for a hospital in Munster, Indiana. I have a set date for my Pfizer vaccine already. My questions are, what would happen if I receive my initial Pfizer vaccine and then my hospital runs out of vaccines due to low stock or no stock? What would happen if I am outside of the time frame to get my second Pfizer vaccine? Would I have to start over? Thank you, and happy holidays.
Thank you, Robin, for the question and for being among the frontline workers who are trying to keep the rest of us safe. Doctor?
Yeah, thanks, Robin. Great question, and thank you for the work that you do. And thank you for already setting that date for getting that vaccine. So look, Joshua, we recognize that it's going to be difficult for some people to really strictly adhere to that, both the 28 days. That said, we're really encouraging and strongly advising people to come back as close as possible to that time frame. But the short answer is that we actually don't have the data to answer that question. We don't really know. That's why we're strongly recommending people to come back during that time frame to get those vaccines. Both the first and the second.
Let's get to a few more quick answers to some questions before we run out of time. Let's listen to the next one.
My question is this. Is it okay for transplant recipients to receive the COVID-19 vaccine? Thank you.
Doctor, transplant recipients?
Yeah, no, great question. So while we don't have exact information on the COVID vaccine on transplant recipients, what we do know is that transplant recipients have clinically worse outcomes from COVID-19 infection than those without transplants. And according to the American Society of Transplantation, the benefits of vaccination outweigh any theoretical risks. So the recommendation right now is it's safer to get the vaccine than to get the disease.
One last quick question. A viewer asks, if someone has a severe allergic reaction to the Pfizer vaccine, should they try the Moderna one instead, or do they have similar ingredients? And would they only need one dose of Moderna given that they've already had one dose from Pfizer? Doctor?
Yeah, so the recommendation, thanks for asking that question, Rob. It's not let's not mix and match. We are not recommending that happen. The CDC, I believe, does say, though, if you get a severe reaction from the first dose, do not go back and get a second dose. I think that applies to one company, not both. But I think do not mix and match. I think that's the recommendation.
I love answering these questions from our viewers. Bear in mind, we will answer more of your questions as the vaccine rollout continues. And again, nothing you hear from us tonight substitutes for the advice of your doctor for your medical situation. Regardless of what questions you have, ask your doctor. Dr. Lipi Roy, we appreciate you making time. Happy holidays. Thank you.
You too, Joshua. Bye.
President Trump appointed 3 Supreme Court justices, but when his effort to